Hi, I'm Sue Oberlich, President of Sensory Testing Systems. We've been providing intraoperative monitoring, or IOM, in the greater Phoenix area for 20 years. Oasis is just one of the hospitals we work at. Let's take a tour of the operating room and see what these tests are, how they're done, and most important, how they can make your surgery safer. Just like the reflex that lifts your finger from a hot stove to prevent a burn, the electric signals that we record can prevent a nerve injury that you cannot feel and avoid under anesthesia.
Hi, my name is Lloyd Buxbaum, and this is Jessica Willis, who will be acting as our patient today. We are both neuromonitoring technologists with Sensory Testing Systems. Most of the time, we'll meet the patient in the preoperative area, explain our role in their care, and apply these electrodes to the wrists, ankles, and scalp. Additional electrodes may be used as indicated by the specific surgical procedure. This is usually when I tell the patient that I'm here to get on their nerves. During spine surgery, we apply a small, safe electrical stimulus to the skin at the wrists, ankles, which travels through the spinal cord and through the area where the procedure is being performed. Information is collected from over the scalp, over the sensory cortex. The corresponding waveform informs the technologist and the surgeon of the integrity of the sensory nerves. Other tests, such as transcranial motor evoked potentials and EMG, may also be monitored during the spine surgery. These tests monitor motor nerves during the procedure. A full description of all the tests we provide are described on our website. Monitoring is also performed during intracranial surgeries. Tests like EEG and brain auditory evoked potentials may be used together with one or more of the previously mentioned tests. Not only does effective monitoring protect the integrity of the spinal cord, it can also protect the patient from peripheral nerve damage, as well as damage due to blood perfusion issues. The position of the patient during spine surgery can put peripheral nerves at risk. Changes in electrical signals inform the technologist of potential problems. The surgeon and the anesthesiologist are informed and the patient is repositioned. This corrects the problem and avoids patient injury. At Sensory Testing Systems, we only employ the best neuromonitoring technologists. All are certified or registered and experienced professionals. We do this to guarantee that we provide the best neuromonitoring services available in Arizona for our surgeons and their patients.
Inadequate blood perfusion can also cause injury to the patient if gone unnoticed. Ineffective perfusion of blood in the spinal cord longer than 30 minutes can cause permanent neural loss. The brain can only tolerate a disruption of blood flow for 15 minutes. In both cases, monitoring can detect and identify a perfusion issue within minutes. With swift communication between the technologist, our reading specialist, and the surgeon, the patient is spared from waking up with an unexpected neurological injury. When these events are recognized and corrected during surgery, blood flow is restored to the nervous system, the signals recover, and the patient wakes up intact and happy.
Sensory Testing Systems is organized to be responsive within these critical limits. Insurance is billed and paid for these services because the cost of treating a new neurological injury post-op and the associated rehab and personal pain far exceed the cost of IOM testing. Without IOM, there is always a small but real risk that surgically induced nerve damage will happen. The only way to prevent this is with IOM.